Okay, I guess I just determined that our chairwoman is delayed, and so I'm going to start this meeting in her absence.
Very good.
Are we good, John? Okay. And I think everyone is accounted for here, minus the chairwoman. So, oh, and I guess Representative Turner. Is he on virtually? I'm just trying to check in and get an accounting of everyone. No? Representative Turner. So, having said that, I think we'll get started with our agenda. And I would, and here comes Chairwoman now. And so before she can get here, I'm going to say that we'll start the hearing on Senate Bill 170. And I think we'll look to the revisor for a little outline on that first. Is the revisor on today, Mac? Or rather, Scott, can you give us some information?
Thank you, Mr. Chairman, and good afternoon, committee. Senate Bill 170 comes to you from the Senate, sponsored by the Committee on Ways and Means. This bill addresses the Advisory Committee on Trauma, which is a part of KDHE, and the regional trauma councils that are established thereunder as a part of the state trauma system for advice and development of the statewide trauma plan. The Advisory Committee on Trauma and regional trauma councils are both directed to conduct meetings during which they are reviewing incidents of trauma injury or trauma care. They are directed to conduct those meetings in closed session. As is standard for new provisions for closed meetings or closed records, that provision sunsets on July 1 of this year for both the Advisory Committee and those regional councils. So the bill would strike the sunset for both of those to continue indefinitely their authority to conduct those closed session meetings for reviewing trauma injury or trauma care incidents. The bill will take effect upon publication in the statute book, and I would be happy to answer questions the committee may have.
Thank you very much, Scott, for that outline. I would look to the committee for questions for the revisor. Any questions? Okay, seeing none, then we'll move right into testimony. I believe we have two proponents, and the first is Wendy O'Hare with the Trauma Program at KDHE. Wendy? I think she's on via WebEx.
Me the opportunity to provide proponent testimony in support of this bill. My name is Wendy O'Hare, and I'm the director of the Kansas Trauma Program, which is a program within the Kansas Department of Health and Environment. I want to give you a little bit of background about our program. We have the Advisory Committee on Trauma, which is a group of 24 individuals who take into account the latest standards in trauma care for healthcare providers and make recommendations to improve those standards across the state. They make those recommendations to the Secretary of the Kansas Department of Health and Environment. They also communicate those standards to the 6 regions in the state. And in the state of Kansas has 6 levels of trauma centers that are designated by our program. And all of those trauma centers are very involved in expressing, assisting with providing the standards within the state. The Advisory Committee on Trauma also takes data from our trauma registry and watches those trends to also set forth those standards. The state is divided into 6 regions, trauma regions, and the borders of those regions are aligned with the Kansas Board of EMS for better collaboration with those partners. The membership of those regions are physicians, nurses, EMS personnel, and health departments. And the regional executive councils members in the region with injury prevention activities and also provide funding for trauma-related education to all of their members within their regions. And they take the best practices that are set forth by the Advisory Committee on Trauma and express those out to all of their partners. As I mentioned, our program also houses the trauma registry. So injured patients in Kansas are entered into this registry, and then we are able to monitor the data from there and trends, and then we target injury prevention activities with that data. So we have the Advisory Committee on Trauma and the 6 regions that have peer review committees. And the members of those committees are physicians, nurses, trauma surgeons, EMS
Wendy?
personnel,
Wendy?
and
Wendy?
I'm
Wendy?
sorry. Yes,
Okay, can you go ahead and kind of wrap up on your testimony, please? Thank you.
absolutely. So those trauma peer committees take a case from a particular injured patient, and they discuss any opportunities for improvement or best practices that have come about from those patients that they discuss. And we want to continue to keeping those meetings as closed meetings, and any documents that are entered into those meetings would be privileged and remain privileged. So I just would ask for your support in this bill, and I can answer any questions that the committee may have.
Thank you very much, Wendy. I think we'll hold until we hear our next proponent. So if you'll stand by on WebEx, that would be great. Thank you for your testimony, and I'll call to the microphone, as I know he's here, Executive Director Joe House from our State Board of EMS. So, Joe, it's all yours.
Thank you, Mr. Vice Chair. Members of the committee, my name is Joe House. I'm the Executive Director of the Emergency Medical Services Board, and we're happy to be here to provide testimony in support of Senate Bill 170. As Director O'Hare and the reviser, Mr. Abbott, shared, you understand exactly what this does. So I'm here to tell you exactly what it will do if it's not sunset, or if it is not allowed to sunset, or sorry, if it does sunset. These peer review committees rely on the next day quarterback approach to things. So they take that multidisciplinary approach, look at things. They're looking at personnel files and such. That happens within a closed session. The sunset clause here simply allows that committee to share what happens inside that closed meeting with one person and one person only. That's the Secretary of Health and Environment. So the Secretary of Health and Environment needs to propagate that change out. They let us know on the EMS side if it's related to EMS, not necessarily about mistakes that are made, but more importantly, the positive things that occur and the things that they need to continue to see within that trauma program. Yes, Madam Chair.
I'm going to interrupt you just a moment because you probably know this bill intimately. There was a House version that passed in another committee, didn't it?
Yes, ma'am.
Okay, just checking.
Twice.
All right. All right, go ahead.
So, yeah. So with that, that was actually the last part of my testimony was just providing that opportunity for the positive. So the Board of EMS does support Senate Bill 170. We urge your support as well, and I'm happy to stand for any questions at the appropriate time.
Thank you very much, Joe. We appreciate your proponent testimony.
I thought my ranking was just playing head games with me, so what it was.
So we've had some good political discourse over here that I'm not privy to. So, but we'll see if there are some questions now for our proponents before we move forward. Are there any questions here today? Yes, sir. Representative Barker.
Go back to the chair, the actual chair.
He's the chair on this bill.
Okay. What committee also heard in the House side?
Financial institutions and rural development.
Okay. It was just interesting. I think this is the appropriate forum, but.
Well, it started with, the House version started with us and then got transferred from us to the financial and rural development, passed out of that, and I believe it's passed off the House floor. So we got the Senate version. So, you know, we need shells, representative, so roll with us.
And I'll support you. We'll
Thank
amend
you.
this rascal and move on.
All right.
This is a kumbaya meeting here today, Representative, so we're all getting along. I think. Are there other questions here?
I'm getting along with the chair. I'm not sure about you, sir.
No,
Yeah.
Parker and I.
Are there other questions for the proponents today? Yes, Representative Turner.
Thank you, and thank you, Mr. Chair and Madam Chair. So I guess my question is, whenever I see a sunset in something like this, why would a provision like this, and I'm not sure who's going to be the best to answer it, but why is a provision like this have a sunset date in the first place? Is there some experimental learning that we wanted, and did we learn, and did we find? I'm just curious why we're taking that step. Thank you.
Sorry, Joe House, Executive Director of the Board of EMS. This is actually just a standard process with any exemption. The revisor is actually the best person to answer the question.
Scott, are you able to help us?
Sure. So I alluded to this a little bit when I described the bill earlier, but to give a little bit more detail, typically when the legislature creates a new exception to public meetings or open records, you include a sunset, typically 5 years, and that's what this one is, 5 years after it's implemented, so that you can come back within that 5-year period and decide whether you want to continue it, typically indefinitely, but you get to make the decision of whether that exception to open meetings or public records is still justified. It's not completely the same, but in the context of open records, actually state statute, the Open Records Act, requires you to conduct that review 5 years after any new exception to the disclosure of public records is created. So this is just kind of a similar provision for a closed session meeting provision that was created 5 years ago.
Are you good, Representative Turner?
Yes, so I guess it doesn't require any quantitative outcomes. It's just we introduce new language and have testimony that it has been good, and on we go. Is that the standard to extend it as you just suggested?
Yeah, so that's entirely at your discretion. Again, not entirely relevant, but in the open records arena, the Open Records Act actually does have some criteria within the Open Records Act statutes that describes the kind of guidelines you go through to evaluate whether a disclosure exception of open records is justified to continue in existence. There's not a parallel provision for an exception to closed meetings. But it is essentially just as you described, you come back within that 5-year period, hear testimony from the interested parties, and determine whether that exception should be continued.
Thank you. Thank you, Madam Chair.
Representative Kelly for a question.
Thank you, Mr. Chair. Just a comment. It was in the committee that I chair, and we did pass it out without any sunset on it this time around.
Thank you for that information. Any other questions for the revisor or for the proponents? Seeing none, then we'll move forward then with the, is there another question? Oh, I'm sorry, Representative Bishop, I didn't see you back there.
Thank you. This is a process question. I assume that there is some written proponent testimony, and I've been perplexed about this the entire session so far. There isn't any on the website, the Kansas Legislature website. And my question is, will there be at some point, I mean, it seems to me that that's where we gather the record that's open to the public on our business. And I'm just curious as to what that process is.
Actually, Representative, I just pulled up the website and it's all there. Have you gone into the standing committee? Then you go into health. And if you go up at testimony until at the 15th.
There was nothing on the calendar, no date on the calendar. And I tried typing in a date and that didn't work either. So maybe it's my technical and.
Yeah, maybe it's something on that, but it's up here right now.
I'd brought it up, and I was going to advise everyone that's on the Kansas Ledge site to look at the neutral testimony, and it's there for your review. I don't know when it was put up. I don't know that. It was there this morning when I looked. But
All right, thank
there's
you.
neutral testimony from Rachel Colombo, Executive Director of Kansas Medical Society, and Tara Mays, VP of Legislative Relations of Kansas Hospital Association.
So I'm correct in assuming that at some point it's supposed to be there, and that's where we gather up the
Right, but it's
record of-
there right now.
Okay,
Yeah.
thank you.
Dave Long, are you with us? Are you on mute?
Yes, I'm here.
All right. So Dave, when did this, okay, does this operate through the email system when you try to upload this to KLIS?
No, it doesn't. I uploaded from the software that I do minutes, and it's uploaded directly then to the legislative website. Representative Bishop may want to close out and come back in and refresh, and that might allow her to see those pieces of testimony.
All right. Thank you, Dave.
Okay, committee, you've certainly heard the proponent testimony, and you're advised that there now does exist written neutral testimony on the Kansas Ledge side if you care to review it. There are no opponents on this bill, Senate Bill 170, which is a repeat of a similar bill from financial institutions, apparently in rural development. But knowing that, I would like to exert my authority, I guess, and go ahead and suspend the rules today and work this bill at this time unless there's blowback. And there is not. So we'll suspend the rules today and go ahead and work this bill with input from our chairwoman.
All right. And Representative, we don't worry about suspending the rules. We just go right into work it unless there's objection. Have that. No, that's all right. Every committee does it different. That's why I just want people to understand different processes. I guess I would offer an amendment at this time on page 6, line 7, from the statute to the register.
So in essence, that will change the effective date to the date of the register. Okay. How does that affect the timeline, Madam Chair?
Seeing as how this bill's already passed one, we're not too concerned about it right now, Representative.
Okay. Representative Barker.
I would second it and indicate that it saves money by going to the register rather than in the statute book. So I'm always about saving money.
Thank you, Representative Barker. Other comments or concerns? I would like to, yes, Representative Smith.
I just wanted to clarify, looking at the testimony online that you've referred to as neutral, they both testify in support. The Kansas Medical Society and the Kansas Hospital Association in their letter.
Yeah, thanks for that clarification. It is support, it is proponent written. Hearing none, I'd entertain a motion on this bill.
No, you're on amendment, so
We're on the amendment. I'm sorry. You've heard the amendment by Representative Landwehr, second by Representative Barker,
to amend to register.
to use the date of the register going forward. All those in favor signify by saying aye. All those opposed, same sign. Okay, so it's now amended. Back on the bill. The ayes have it. The ayes appear to have it. They do have it. Now we're back on the bill. Representative Parker.
Thank you, Mr. Acting Chair. I would move that we pass out Senate Bill 170, favorable for passage as amended.
It's been moved and seconded. Is there further discussion on this motion to move out Senate Bill 170 favorable for passage? Seeing none. All those in favor signify by saying aye. All those opposed, same sign. The ayes appear to have it. The ayes do have it. It stands approved and will go to the floor.
All right, committee, thank you. Now we're going to turn our attention to Senate Bill 238. And if you've had any time to pay attention, or actually look at that bill, I guess I should say, it would look similar to House Bill 2160, which was the CCBHC bill that we passed out of this committee. And it has It was actually the CCBH bill, the House bill was supposed to come back to us last week. A mistake happened, and so we're going to deal with the Senate version of this. Also in the Senate bill is the BSRB bill, in a little bit different version than what we passed out of this committee and is actually passed off of the House floor. So you're actually looking at the CCBHC bill and the BSRB bill in one bill. Rather than go through the entire hearing process all over again, which was pretty extensive on both of those bills, we're going to go right into working this bill. If you have questions, please feel free to ask them at this time. Representative Parker, you only get one. Now you're using it.
I'll try and make it count. I know you said this combined the BSRB bill and the CCBHC bill. Does it also include the telemedicine piece that we had put in the BSRB bill, or did they do that differently?
Scott, I believe it does, doesn't it?
Yes, Madam Chair. So Senate Bill 238, as amended by the Senate Committee of the Whole, includes the provisions of 2208, which was your version of the BSRB bill, as this committee amended it and as it passed on the House floor. So it includes the committee amendments that removed the board-approved supervisor position for clinical social workers, and it also struck that minimum hours requirement for social worker practicum requirements. So those provisions are all exactly as they left this committee.
Permit a follow-up. Yes. Scott, does the actual CCBHC piece, is that identical to what we had in the House, or has there been any substantive changes aside from rolling the other, the BSRB into it, but just the clinic part of it? Has that been changed at all?
So the only change to the CCBHC portion is the Senate's date or deadline for implementation is January 1 of 2022. As it left this committee, it was May.
Thank you. Thank you, Madam Chair.
Further questions, Representative Barker?
Scott, just one question. Is there anything in the bill that we did not pass out in the House bills? Any additions?
No, Representative.
Those guys in the other body are a little sneaky sometimes.
Sure. So as I discussed, the amendments to the BSRB bill are the provisions are exactly as they left this committee. The one thing I didn't mention specifically was the telemedicine section that was added. That is also identical as it left this committee. So this bill should be the combined total of the BSRB bill and the CCBHC bill as they left this committee, with the one exception of the date change.
Thank you, Madam Chair.
Representative Reese and then Representative Lynn.
I'm just curious, why did they combine the bills?
They're the Senate. There's no rhyme or reason.
That's what Representative Barker said, they're sneaky, I guess.
Well, there's only 40 of them, so. Representative Lynn.
Thank you, Madam Chair. I believe the fiscal note changed when we changed the date to, May, I think, of 22. And that was based on the recommendation from Sarah Fertig, I believe. Mm-hmm. So has the fiscal note changed, and are they able to implement an earlier start date?
Actually, we're going to amend it one more time and change the fiscal one more time.
Thank you, Madam Chair.
Are there further questions on the procedures and the process that we're doing right now? Because if you've got any, I want to make sure that we're answering them for everybody, because what they allow us to put on our agendas on the KLA system does not always come out with a clear understanding of what's happening. And I always want to make sure everybody knows what it is that they're voting on and why. Representative Reese. If it was sneaky, it's Parker's problem.
Can you remind us again why we had the later date in the House?
Because I think if I recall correctly, and Scott can correct me if I'm wrong, is I think that the date was actually like January 1, and they said that wouldn't be sufficient time. The agency said it wouldn't be sufficient time for them, so we moved it down to the May 1. Is that right, Scott?
Yes, Madam Chair, that's my recollection.
Okay, I'm feeling good. The puzzle pieces have been moving everywhere, and I get lost sometimes, but excellent question. Are there any further questions on the bill? All right. Scott, do you have my amendment? And is that something that can be sent out to everybody? Are you emailing that?
Yes, Madam Chair, I am emailing it to committee and staff now, so Dave Long could post it to the legislature website, and I'm also able to screen share it here in just a second.
All right, that's fine.
Okay, so you should receive the amendment in your email momentarily.
Okay, while we're waiting on that, I believe Representative Lynn's got a question.
Yes, thank you, Madam Chair. I'm looking online and I only see the original fiscal note. Is it normal for them to update that? Will we be getting an
No.
updated one? No, it's
No.
not. Okay, thank you.
Has everyone received it? Representative Arnberger, would you mind sharing your screen? Yeah, please. You sure? All right. All right, committee, this here will be an amendment. And Scott, I'm just going to let you run through the amendment because I think we've got 2 or 3 different sections into that. If you would do so, please, I'd appreciate it.
Sure, happy to. So the amendment begins on page 1 of the bill. This is to the CCBHC section of the bill. The first thing the amendment would do is strike the language directing KDHE to establish the payment system under Medicaid and to submit approval to the federal government for the implementation of that funding mechanism. It would also make some corresponding changes to the rules and regulations subsection to remove the reference to KDHE, as that funding mechanism was the only reason that they were included in that rule and regulation authority. The second change, if you'd like me to continue with that, Madam Chair.
Let's see if there's any questions right now with the first piece. You used all your questions, Representative Parker, but go right ahead. Yes.
How about I just phrase this as a statement and you can agree or disagree at your discretion. So if I caught that right, the first part is we're deleting the language on funding from a federal level. I believe I understand the reasoning behind that, but want to confirm we're essentially trying to remove references to Medicaid to this bill.
Yes, sir. You'd be right.
Is the bill itself, I guess this might be a revisor question, but if theoretically, not that we would expect them to do so, if the Senate just concurred with this sort of change, would the bill still be functional, or does it absolutely require conference committee to go ahead and essentially reinsert some language to clarify that piece?
There would have to be a trailer bill for a funding mechanism. You're right.
Thank you. Thank you, Madam Chair.
Mm-hmm. Go ahead, Scott.
Okay, so the second thing the amendment would do is on page 2 of the bill. It would change the implementation date. So as I mentioned when I was describing the differences, the Senate's implementation deadline was January 1 of 2022 for the entirety of the section. The amendment would strike that implementation date and instead replace it with a kind of staggered implementation schedule requiring KDADs to certify CCBHCs on a schedule with numbers of facilities specified per year. So in the first batch is the 6 facilities that are currently receiving grants to operate as CCBHCs. Those would have to be certified by KDADs by May 1 of 2022. The next set would be 3 additional facilities by July 1 of 2022. The next set would be 9 additional facilities by July 1 of 2023, and then 8 additional facilities by July 1 of 2024. It would also give KDADs the authority to implement certification for those facilities ahead of those deadlines, including if they were able to do so kind of on a partial basis. So if they couldn't do all 9 of the facilities that are required to be certified by July 1 of 2023, they could, for instance, do 3 of them earlier in that fiscal year, so long as they had the entire 9 done by that deadline of July 1 of 2023.
Representative Arnberger.
Thank you, Madam Chair. Scott, as it's written right now, and maybe it's somewhere down the line, does KDADS get to decide which 3 and then which 9 and which 8, or how are they going to pick which community mental health centers?
So there are no guidelines beyond the 6 initial ones that are the current grantees.
Yeah, I guess, Representative, we could come in and explain, and maybe we need to do that, Scott, I don't know, is the first 6, which would go into effect on May 1, are the 6 that currently have the federal funding to be a CCBHC.
Mm-hmm.
So then they would be certified then by the agency. The additional 3 would have to be whatever 3 were able to apply and get certified then by the agency. Then the next batch, the next 9 would be work in the same manner. And this is just to reduce the only reason we're doing it this way here was to try to bring down the fiscal note.
And I agree and like that idea. My only concern is I feel like, and maybe many others feel this way as well, that rural Kansas is always the last one. And I would hate, and I'm just trying to make sure that we're not going to be, not all of us are going to be in the 8 in the last, and that hopefully we can get some rural Kansas folks served, maybe in the 3 or the 9. That's all I'm getting at.
Kyle, can you answer a question for us, please? Go ahead and tell us who you are.
Kyle Kessler, Executive Director at the Association of Community Mental Health Centers.
Thank you. So currently in our 6, how many of those are rural Kansas?
4-county mental health center, which covers Wilson, Chautauqua, Montgomery, Elk, and Cowley counties. Horizons, which is Reno, Barber, Kingman, and I think I'm missing 1 or 2 counties in there. So those 2 would be the most rural and frontier, with them each having semi-urban areas of Independence, Coffeyville, and Hutchinson. The remaining 4 are Wyandotte Mental Health Center, ComCare in Sedgwick County, and then the other 2, in Southeast Kansas Mental Health Center, which is Allen, Bourbon, Neosho, and several other smaller counties. And then there's a 6th one that is escaping me right now. But so probably half of them. And then of the 3 that you mentioned additional, there are 3 more that are applying at the federal level. And one of them is High Plains Mental Health Center, which covers 20 counties in western Kansas. Another is the Guidance Center, which is Leavenworth, Atchison, and Jefferson counties. And then Pawnee Mental Health, which is North Central, which has a lot of small counties.
That makes me feel a lot better. Thank you.
Was Salina the 6th one?
Yes, it was Central Kansas Mental Health.
Okay. On the ones that you were saying, that you were talking about applying now, I was thinking that Johnson County was one of those that's applying right now. Is that not correct?
I think they're holding on to the next phase.
Into the 2nd phase of 9?
Yeah, well, so there's an open application process right now. And then we're expecting another one coming down the pike in 4 or 5 months as part of the ARP Act. I think they've got funding for another 105 grants in there across the country.
All right, so what could actually happen, correct me if I'm wrong on this, Representative Arnberger, is that the feds could come in and continue adding CCBHCs with their funding mechanism that they're doing, but it doesn't necessarily mean that they get certified by the state in this bill until a certain time forward.
Yeah, about a 2-year range is what we're looking at. So for example, in practice, part of the reason behind the May 1st start date for 2022 is that 4-county their 2-year grant period is up on April 30th, so they would be live without a net. So either they would end up having to start laying off staff or draining from reserves. Does that make some sense?
I just don't want to be last.
No,
That's all.
I don't want you to be last.
I think my family in western Kansas would be upset if I let western Kansas go last. Kyle, thank you on that. Representative Bishop?
Thank you, Madam Chair. Kyle, you might want to stay close, if I might. What I'm concerned about is with the removal of the prospective funding, my understanding, if I'm not mistaken, is that to become a CCBHC, in essence, a center is taking on some additional responsibility. And I understand there was some talk of a trailer bill and so forth, but that makes me nervous. And I want to make sure that we're not perhaps setting folks up for failure because they're broadening the service that and the way that it, my understanding was one of the goals is to not have waiting lists, and that's intensive. And so can someone straighten me out on that as far as sufficient funding to meet the goal?
Actually, that would be a chair question. It's kind of a unique situation, Representative Bishop, that we're dealing with. You were on the Mental Health Modernization Committee, and this was one of the top priorities out there. And I think it's also, I think that, the way that the original House bill went out of this committee also showed a commitment that the legislature has to this issue. The problem is that we can take and go straight to conference with this issue because it has passed the Senate, or we can allow legislators to have an opportunity to vote on this issue on the floor, and pulling that funding mechanism at this time is how we allow that issue to happen on the floor. I can assure you the funding mechanism will be back in at some point before it goes to the governor's desk this year.
Thank you, Madam Chair.
Is that good? It's not fun. It's not ideal. I don't like it, but it's what I have to deal with. Representative Reese. No, I give him a hard time. You can ask however many you want. He's on a limit.
He's on a limit. I'm just needing, I'm more of a concrete kind of thinker, and so I just need a little clarification from what you just finished saying. The mental health centers will continue to be able to bill Medicaid at this point. That's the only way to pay for case management. And they can continue to do that, correct?
Yes, because this bill isn't in law. So until this bill gets signed by a governor, and it won't be signed by the governor in this form, I can assure you that.
Okay, all right.
It's unorthodox, it is.
Thank you.
Are there further questions? You used all yours earlier. I must, keep a list of how many that he's in the hole right now. Representative Parker.
If you prefer, I can just text it to Representative Ruiz and have her ask it.
Okay, now we're putting Ruiz on a.
I want to clarify on I think the second section of this where we lay out how many can be certified at a time. The new language, and this may be revisor question here, it seems it shall certify this number. Is there any issue if we get through phases 1, 2, and 3, and perhaps the last few CMHCs do not wish to be certified in this way? Or are we creating any problems for ourselves down that road by having it be shall rather than may, or another wording entirely?
Scott, do you feel like that puts us into a position, because we know today that more than likely out of our 26, there will only be 25 that move this level. Are we putting them into a bind if they would have to, no matter what? Because we want to make sure that it happens.
So I don't think the bill is doing anything or would do anything to force a community mental health center to seek certification as a CCBHC. So I don't think, I mean, if there are, for instance, if you hit this last phase for 2024 and there are not 8 additional facilities seeking certification in this capacity, that you create any problems.
Yeah, Representative Parker.
Thank you, Madam Chair. I asked this question, my intent is not that we should give discretion and say they can reject them if they meet the criteria. I just don't want to, whatever administration it may be, 2024, their, Department of Aging and Disability has statute that says they're supposed to certify 8 facilities and they only have 6 applications. I guess that's not the end of the world, but it just seems like that might be slightly messy.
Kyle Mins, you're the head of that association. Would you like to comment? If not, you don't have to.
I might be able to help. Kyle Kessler, Executive Director at the Association of Community Mental Health Centers. I think if you even potentially added the wording upon application, the department shall certify, that probably solves a legitimate concern.
That would do it for me. Thank you.
Can you fix that, Scott?
Yeah, so I think at the beginning of the new language, this block here, I would just begin it with subject to applications, therefore, KDAD shall certify, and then keep the rest the same, and that should address the concern.
That works. Good question. Thank you, Kyle. Are there any further questions? So we just made a technical on an amendment. Does everyone understand that? We're setting, and I haven't made the amendment, motion for the amendment yet, but. Does everyone feel comfortable with what it is that we're doing? Because if we came in with all of them at the same time, that's where they were having heartburn with the fiscal note on it. And we believe that should the agency find out that, that they can do some of these sooner, then we want them to have the flexibility to do that. So we're also looking at language for that and can hammer that out through conference, just FYI. So right now, I would make my motion to adopt the amendment with the language on the certification process. Is there a second? Seconded by Representative Kelly. Discussion or comments on the landwear amendment? All right, seeing none. All those in favor of the landwear amendment, seconded by Representative Kelly. All those in favor signify by saying aye. Aye. Opposed, no. Ayes appear to have it. Ayes do have it. Motion carries. We're back on the bill. Any further questions or discussions on the bill? Representative Epley.
Madam Chair, I would like to move Senate Bill 238 as amended favorably to the floor.
Seconded by Representative Parker. Questions or comments on the bill as amended? All right, seeing none. All those in favor say aye. Aye. Opposed, no. Ayes appear to have it. Ayes do have it. Motion carries. That committee concludes our business for today, and I appreciate all your patience, and I hope that you're feeling comfortable with the process. Don't be afraid to ask the questions, because we're not wanting to put any surprises out here. As I told Representative Parker when he joined this committee, is I like surprises, but only if it's monetary. Then you can surprise me in my favor. But otherwise, we want to make sure you understand everything that we're putting out there and why. So we're adjourned till 1:30 tomorrow.